Nairobi remains Kenya's epicenter of the pandemic. In the last 24 hours, 12 new deaths were recorded in the county, the highest COVID-19 related fatalities recorded in 24 hours. 9 of the fatalities occurred in various hospitals and 3 in the community. Of the 189 new cases recorded, 147 were also in Nairobi. 77 were recorded in Dagoretti North, 10 in Embakasi East, 10 in Makadara, 9 in Embakasi East and 9 in Kibra.
We would love for you to come to Nairobi, but we are telling you that there is a high possibility that by the time you are thinking of coming to Nairobi, there will probably be no beds in Nairobi because of the number of cases that will be there. If you lock up another 1 month and another 1 month, what is the additional asset you are adding to the country? Is another month and another month going to make Kenyans more and more aware? Which Kenyan is not aware now?
However, the cost of testing remains a critical question for many Kenyans, with the government now calling on private hospitals to lower the cost.
When you are picked from the county, we are still charging 1,000, but we had put a program for hoteliers. That's what we were charging, the charges we said. We have left Mbagathi specifically for the sick. That's why we have stopped the process of triaging within Mbagathi, because we don't want to expose most people. We are still doing some testing at Kenyatta next to a clinic called Clinic 66.
Targeted mass testing, we do not charge anything. However, as Daktari is correctly saying, we are not doing testing for everybody.
To boost capacity in contact tracing and surveillance, the government distributed vehicles to 13 counties. A web-based system for contact tracing is also in the works, with tracing teams in the counties now being trained on its usage. As Kenya braces for a peak in the coming months, of importance remains increased capacity in terms of surveillance and targeted mass testing. This will be a defining week after the restriction of movement has been lifted. Dorcas Wangira, Citizen TV, Nairobi.